Let's shine by seeing the best in all of us. And by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan, program host for Let's Talk Together. And today we have joining us Dr. Brian Kwong, and he's with Reed Heart and Vascular. And thank you for joining us today.
Thank you for having me.
And Dr. Kwong, tell us a little bit about how you yourself and how you came to Reed.
Sure. So I'm actually a bi-coastal from New York, the city, upstate, also along the entire coast of the West Coast, Northern and Southern California. And I did some of my training in the Midwest in Michigan, Detroit. So I got to Reed because, with my experiences and traveling around, I was looking for this more of a small town feel, get to know my patients. It's one of the benefits of Vascular as well. I get to follow my patients for long periods of time. So when there was an opportunity, I decided to take it.
Oh, great. One of the things is we know February is American Heart Month, and one prominent factor in one's heart health is vascular health. So can you elaborate on how are these related?
Yes. So, I always like to use an analogy to help make things easier to understand. And one of the best analogies that my patients have been saying that is very easy to and helps them understand is, the heart is like the water treatment plant of a city or a town. And it's providing the water and the pressure for all of the neighboring towns. And the vascular system is the piping that goes to each of these houses and businesses and facilities, and which in this case, it goes to all the organs in the body, including the arms and legs.
Then what are some of the common ailments that can affect those vessels?
So just like plumbing, you can have breaks in the plumbing, you can have clogs, you can have pipe bursts. So in the vascular world, we have blockages or occlusions, occurs similar in the heart. You could also have aneurysms where they get pressurized, they get bigger and they can rupture, things of that nature.
Then, so what's an ailment that's most common with patients you see in our community?
Yeah, and I think this is a bigger issue in all of the United States due to our nationwide diet and still the prevalence of smoking. One of the biggest issues that we see often, and what I've been seeing often in this community, is peripheral arterial disease. Basically, that's occlusions of the arteries that lead from the heart that go to whether it's the organs or the arms and legs.
And you were saying, and with that, we have a preponderance of smokers in this
I think
area.
so. Yeah, majority of my patients, they either have smoked before or they're still currently smoking, and that definitely makes treating it more difficult.
And what are some of the things that you share with those patients?
So I always talk to them about why they're in the position that they are in terms of having these blockages, because as we age and as a society, I think we accumulate all sorts of different ailments, and one of these ailments is the peripheral arterial disease and these blockages. And there's only so much you can do. I mean, we always talk about genetics, helping us along, but it could also hurt us. But there's nothing you can do about it. But there are some risk factors that we can definitely improve. Some of the factors I always talk about is blood pressure, so hypertension, their cholesterol issues, whether or not they're diabetic, and again, whether or not they're smokers.
Then with this, some of the causes of ailments, such as like plaque or clots in your arteries and veins, and in preventing the flow in arms, your legs. And it says 90% of the time, vascular disease is a function of time, as you were just sharing with us.
Right. So all of these factors, they affect blood flow in different ways. The way I say it is, the heart is pumping, it's creating that pressure. If you have high blood pressure, your heart's pushing against it. It's generating the pressure to go against it, and we're just measuring the pressure that's a result of that. So it's high resistance flow. And so if you have high blood pressure, the heart's going to have to work harder. Now, if you have cholesterol, if you can imagine just like the nature of just having blood flow going through a tube, it's going to brush up against it, it's going to injure it, you can have these micro injuries to it, and as the body tries to heal it over, the cholesterol will stick to it, and then it's sort of like spackling on a wall where you sort of keep on putting new coats of paint, new spackling, and you end up invading into the space, the inner space of the tube. So now you're invading, making the space that the blood flow is smaller. Well, now you're talking about with diabetes, it's compounded on top of that because not only is your blood not nice and thin and liquidy like water, it's now this maple syrup or honey texture, and you try to suck up a straw with honey,
right.
It's quite difficult,
yes.
right? So then you throw on smoking, and there's a lot of talk about the ailments of smoking in terms of lung disease, cancers, and things like that. But for a vascular standpoint, it's the medication that's in it, the nicotine. So that applies to all of nicotine, including patches and gums and chewing tobacco, cigars. Well, the nicotine is a very potent vasoconstrictor, so it tells your blood vessels to clamp down and shrink. So not only does your heart work harder because you have high blood pressure, but now you have thicker fluid that has to go through it, and you have a smaller lumen just because it's clamped down, and you've got plaque in there. It's just a recipe for disaster.
And we haven't, but I was just wondering, does vaping contribute to that, or?
Well, as far as the lung issues associated with vaping, I don't think there's adequate evidence on that. But there are vaping mixtures and flavor profiles that have nicotine in it, and I would imagine it probably has a similar effect. The amount of dosage required is unregulated, so I wouldn't know that.
Okay. And let's look at, for the lower extremity, arterial disease, looking at rest pain?
Sure. So most commonly, I get patients that come in and say that their legs hurt, and at that point, I have to decide on, at what point is it related to the blockages? Because when you're talking about pain in the legs, it could be any things. It could be, bone pain, it could be muscle pain, it could be nerve pain, and then it could also be blood flow related pain. And, as a vascular surgeon, I deal with the blood flow related disease, and so we call it, lower extremity arterial disease or peripheral arterial disease. When I talk to them, it's about a spectrum. Going back to our analogy with pipes and water flow, most of the time you don't really realize there's a problem until you turn the faucet on, right? So the same thing with blood flow and the muscles. So the blood flow, it supplies the muscles. The muscles are very sensitive, and generally speaking, there's a spectrum for it. So you start out with what they call claudication. Claudication is where you have enough blood flow normally because your faucet's off. You're not using your muscle, you're sitting very comfortably, and you're fine. Then you decide to go and do this walk with the family after dinner and try to take this lap around the block, and you're feeling like, your legs are getting kind of tired, kind of cramping, kind of pain, but the muscles is what you're feeling the sensation in. And that's claudication. It's where it's just not quite enough when you need the extra nutrients, and the new blood flow doesn't quite get there. And then, as you mentioned, rest pain, that's the next level of the spectrum, where even if you're doing nothing and your faucet's off, or even just tiny cracked open a little bit, your muscle is already telling you there's not quite enough for me to do anything. You ask for some movement and it can't quite do it. And what's most concerning is that on the other side of the spectrum after that are wounds and ulcers, and that's the biggest issue. Is as you're moving towards the blockage spectrum, you get towards wounds and ulcers, which is where blood flow is not even enough to sustain the life of the cells, the muscles, the bones, the nerves, and so everything is now screaming out at you, and the integrity of the tissue is now compromised.
And with the wounds and your ulcers, and with looking at the skin, the pain, the muscles, and then we go to risk of amputation.
Correct. So generally,
walk us through that.
Yes. So generally speaking, claudication is a good place for you to see somebody about it for vascular surgery, because the risk of limb loss is very, very low. Which means the risk of amputation is very low, because you're on this far side of the spectrum where it's just your muscles, everything else is doing okay, and that can be improved potentially without surgery. Your body can actually you manage your risk factors, you quit smoking, and you exercise, and you can kind of exercise yourself out of the claudication and improve the blood flow and let your body deal with that aspect. And so, I typically try not to intervene on that scenario unless it gets progressively worse. And then when you hit, like you say, rest pain and wounds, well, then that's basically a sign that says that that you have a pretty high risk for amputations and limb loss, because the tissue is not able to survive. And so at that stage, the disease may be so significant that even attempting to treat it or repair it can be challenging.
Is there certain age groups that you see more challenges with, or staying on top of the diagnosis problems?
Yeah. Typically speaking, when it comes to peripheral disease, like I said, it's time-based, right? Over time, you build plaque. Over time, you have more injuries. The scarring and the blockages occur over time. So generally speaking, my patients tend to be of older age. But I've also seen younger patients that, for whatever reason, maybe it's genetic influence onto it, it occurs earlier. But generally speaking, it tends to be older individuals, yes.
We'll get through there. Now, when we're looking at all of the risk factors, and how do they play together with the disease and its advancement? So any of the different risks.
Right. So as I mentioned, those four are the main ones that we know of, okay. Right? The blood pressure, the cholesterol, the diabetes, the smoking, and those are the modifiable ones, right? Like I said, you can't really do anything about your genetics, and so all you can do is mitigate as much of the modifiable risk factors as you can, and hope that it's enough. Right, and then that's what we are here for, is to kind of help you along in that sense. If you do everything you can for the risk factors, then that's what we're here for, is to continue maintaining everything and preventing the potential for amputation.
Now, what are some of the back on with the risk factors, mm-hmm. and some things we can do to prevent some of the risk factors from happening?
Right,
like some things on prevention.
Right, sure. So obviously smoking is a straightforward one, right? Mm-hmm. That's just, quit smoking, quit using anything that might have nicotine in it, okay? That's a pretty straightforward one to mitigate. Diabetes is a very difficult one these days, especially with the use of, high fructose corn syrup and everything, and the carbohydrates that are built into everything. So that's really difficult. So that's something that is a lifestyle change. You have to watch your diet very, very carefully, and make sure that you take the medications that are necessary for the diabetes to keep your blood sugar as low as possible. Now, oftentimes I have patients that say that it's not that bad, right? And you're right, it may not be that bad, but over a long period of time, it adds up, right? It's just adding up a little slower, and my goal here is going to be to push you until it's the best that it can be. So you want to minimize those sugars, and then cholesterol. I always recommend taking a cholesterol-lowering medication of some kind, whether it be a statin that is generally considered very safe, or one of these newer injectable medications that can be used. The evidence is so far looking pretty good, and the administration is pretty easy, and insurance will cover many of these, so that's very helpful. And then obviously, diet. You want to be careful about the fats in general, because they're still calorically high in calories. Right. And then blood pressure. That's a function of sometimes your body and sometimes stress. Sometimes we don't talk enough about our mental state, but stress can play a huge role, whether it's stress at home, stress at work, or just personal emotional stress.
And that's good that you're mentioning it, because then that continues to put that in the dialogue.
Right.
And often people don't think about the stress factor.
Right. And the blood vessels in the body, they go everywhere, right? All tissue has blood vessels in the arteries, veins, and they're all created somewhat equally. They're different in size. So any disease process that can occur in one set of blood vessels, for example, in the heart, can also occur in the legs or in the organs.
And also within the prevention side, we discuss more on the meds or what people's, just making sure that they take them. I think lately has been a big issue, experience with people would say, I have the meds, I just didn't take them.
Right, and I think some part of it is a personal, right? So some part is personal, some part of it is going to be education, and I think that in our community as a whole, not just in Richmond or Indiana per se, but on both coastlines where I've been, I think that education for personal health has been a challenge, and I think there's definitely been a move towards personal responsibility, understanding the medication you're taking, understanding why you're taking it, and if you're not understanding what the purpose of that medication is, you should ask, because that's information that's obligated for you. And so in my office, I try to explain again why all these risk factors are important and how taking the medication and how the lifestyle changes can affect that. And it's up to them to move it forward, but at least they have an understanding as to how it can benefit them.
You're singing songs to my heart right now, because we're always trying to push community education.
Right.
So,
Absolutely.
Hopefully, as people see this episode, that they will learn.
Yeah,
and
that'd be helpful.
Especially through the prevention side.
Yes. Yeah, and there's tons of programs that can help with it, right? And nutrition is a big deal. It's a like I said, lifestyle change. So I used to do training in a bariatric facility, so we did a lot of bariatric procedures, a lot of nutrition discussions there, and you got to take it at baby steps. Any progress is considered progress, right? So, you may not be able to cut out every soda in your life, but you may be able to convert it to something that might be slightly more healthy, and then work from there. Right.
Great. We have on some of the treatment options that are available.
Sure.
Like a heart CT scan. Can you share about that?
So, in the vascular world, we have a few diagnostic tests. We have some invasive, some non-invasive tests, and all of those is just to take a look at the blood vessels and see what kind of disease we have in it. All right, whether it's a CT scan or an ultrasound. And they're very useful to me because they provide information as to where these blockages might be, how severe they are, and whether or not they're significant. Because not all blockages are significant, right? If you have a really large pipe and you have a little blockage there, it may not affect anything. But if you have a really, really tiny blood vessel, this little 1 or 2 millimeter blockage may be significant, right? And that's definitely true in the heart, I would imagine, is those blood vessels are so tiny, right?
Right.
And so that's the same issue when it comes to vascular surgery for me as well. And so once we do the diagnostic testing, then we have to decide on let's say it's significant, we need to help maintain it and try to improve it. We always start with less invasive, and I imagine it's the same thing with the heart, right? They start out with heart caths if they can, and then they go over to the traditional open bypass, right? So it's the same thing for my field as well with vascular surgery. So we start with endovascular techniques. We go inside the blood vessel. We try to get through the blockages or the narrowings, and we try to stretch it out with a balloon, or we try to stent it, or we try to remove some of it. There's some special techniques and tools nowadays that we can kind of remove some of the plaque, and then go from there. And then if those don't work, then we have the open procedures. Same thing, same idea. We do a bypass and go around it. The restrictions for these obviously is once you start the process on it, the blood vessels are now irritated and inflamed, and so you never know how your body's going to heal for it. And whether it's the heart or any other blood vessel in the body. So if you're in claudication size, I would urge not to intervene on anything unless it's necessary, because again, your risk of limb loss is low. And once we start poking around in there and stretching it out, putting a stent in, now you have a foreign body in your system that we don't know how your body will react to it, right? It may tighten it up faster, it may be fine with it. But you never know. So you try to wait as long as possible to do these maneuvers.
When you're saying where you're waiting as long, now this has been, if a person actually, so it's just the process of coming from a screening, or if they'd had a challenge,
Right.
that they came into your office.
Right. So it
normally
depends.
you have a referral.
Yes,
process.
for me because I'm a specialty office. It's either they have had a screening and they spoke to their primary care doctor, and I get a referral from them, or they've seen another specialist, say a spine physician, a spine surgeon, orthopedics, where they have again leg pain that may be related to something else. But like I said, you may have more than one thing going on, and so oftentimes I get referrals from them to screen them and see if there's anything else that we can assist with.
With and as I'm trying to really push prevention.
Yes.
And so when people say they need to see you or they have been referred, what's some of the main things that they have had a challenge with?
Yeah, usually it has to do with because usually I don't see the athletes, right?
Okay.
So because they train, they're very good with their body, and they know where their limitations are. Generally speaking, I see patients that are average. They have their day-to-day routine. They go to work, they go shopping, they go home, and then they come to tell me that they have leg pain and that they can't do these normal day-to-day things that they want to do with their friends, family, for themselves, take care of themselves, things like that. And so most of my patients, they say they used to be able to go out to the yard and do some gardening, and now they get to the mailbox and their legs are screaming at them, and that's how they usually end up with the referral to me.
So that's because often when people will say I had this type of pain or that type of pain, or so often I'm just trying to get an idea. So when people say it's something that so basically it's something that you'd normally been able to handle.
Right. Well, because like I said before, it's a chronic situation. It develops over time, right? So it deteriorates over time. So if you think about when you first start out, you have no issues whatsoever, and then you don't test it. So you don't go for that run, you don't go for that long hike or that long walk over time, because you get older, you get busy, you have the weather changes and you can't do it. And then so when you get back to it, you feel like you used to be able to do it, and then now for whatever reason you can't, and you figure out what the symptom is, right? If you have breathing, let's say you have breathing issues and you can't go very far, well, you know that you're going to go see somebody about your breathing, right? So in this case, they try to go do their hike, or they do their normal walk, or they go out and do shopping, and they're like, I used to be able to do this without any trouble, but my legs are really getting tired faster than I ever remembered, or they're quite painful. I have to wait a long time to rest and let it get better before I can get going again. And that's when you start looking at and you talk to people like, who do I look to talk to about legs, right?
And so with that, we could say, so if someone needs to get in touch with you, they would make an appointment how?
Yes, so they would talk to their primary care physician, because that's usually where I get my referrals. Or you could do a screening. So there's a vascular screening test. It's non-invasive. It's quite quick. They check general overall blood flow in the legs. They also check the blood flow in the aorta in the belly. They also check the blood flow in the neck, blood vessels. So it's sort of a good way to kind of do a once over. It's the most common locations you might have an issue. And so if the test comes back abnormal, even if it's very mildly abnormal, it'll ask you to talk to your primary care for a referral, and that'll be an indication to come see me.
Okay.
Yes.
So that's great. So we want to thank you for joining us today.
Absolutely.
On Let's Talk Together.
Thank you.
And thank you for joining us today on Let's Talk Together.
Let's shine by seeing the best in all of us and by looking out for everyone's well-being. Let's shine by staying true to ourselves while surging toward the future. Let's shine with the best care possible and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.